My name is Bailee Armfield. I am currently an employee at Ouachita Medical Clinic and enjoy it very much. Job title is a certified clinical medical assistant. Kind of what led me that direction was I wanted to be able to reach out and help people and just give them the help they needed, try to soothe, so to speak, and make them understand, hey, it's going to be okay. You're here for help. What do you need? We can help you. Let me, get everything possible. Pretty much after that, confirmation, so to speak, through prayer, just trying to figure out what I needed to do. It was placed on me, especially after which my grandmother, she always told me to follow my heart. So I followed my heart with, medical. 3 years ago, my great-grandmother was brought home on hospice. And just kind of seeing the process of how she got from point A to point B and then being brought home, just kind of seeing how, physically her body went from one thing to the next and then being brought home, I was always really curious as to how did that happen? Like, what was the process of point A to point B, then to C, so on and so forth. And that's also the one that told me to follow my heart. So she's very special in my life. It was actually when I was a senior in high school, still trying to figure out where I wanted to go. And that was almost, in a way, a confirmation, like, you're wanting to understand and, be led to understand things more. So I guess, in a way, her condition and the way of her passing was sort of an inspiration because I wanted to understand it more, and then which brought me to come into Delta and apply for the classes and get in. And then once I got in there and did my clinicals with, the nursing home and went into Ochsner for more clinicals and just seeing different conditions and being able to help those people. From the time I started with Miss Stacy Andrews in West Monroe's location, it was awesome. She was a great teacher. She got personal with you if you needed to go talk to her about something, or if you needed more, so to speak, like a one-on-one, like, hey, I don't understand this in class. She was like, well, come on, I'll help you. Like, she was so straightforward with you. She helped you understand. She gave you little tips and tricks on things like, hey, this is a way to help remember this, and this is a way to help remember this. She did my CNA course and my EKG course. It was so easy. I mean, the method of how she did things from the moment that she started teaching to the end of the class, if I didn't understand something, I went to her and said, hey, can you help me out a little? Like, she was thorough. And then when I got to Miss Tara Orals for my phlebotomy and MA classes, I fell in love with her. She is just the most kind-hearted, most godly lady one of the most godly ladies I've ever met in my life. And there are many like that in my life, but from an instructor standpoint, having someone who, one, will not only talk with you, but will pray with you over situations, simply came to us and wanted to help us with things. And I can't even express how helpful each of the instructors, even the ones outside of the classroom that would come in and help, it was just, they are all so thorough and so kind-hearted. I absolutely loved my experience here. Obviously, you study your EKG, you study your phlebotomy, and you figure out all of this other criteria within the MA classes that you learn. And I brought all of that with me, but I think one of the things that I brought with me the most that I use every day is my critical thinking. Definitely within each course we were taught in classes and out of each book we learned, there was always something that hit on critical thinking. So I tried as hard as I can, even every day still, to instill critical thinking, and that's possibly one of the largest things that I use every single day, even outside of work. Everybody that's family, friends, they all encourage me to, hey, keep pushing yourself, keep doing good for yourself, you're doing great. The inspiration from my friends and family who see my improvements and see where I've come from and where I'm at now, they push me to do better each day, and I'm beyond grateful for it. I always have a smile on my face, no matter what's going on in my personal life. When I walk through the door of that office, I know it doesn't matter anymore. That stays outside. You don't bring it in, because some of these people are going through something similar or something worse, and they're coming in to get advice and help seeking it from you. There was a patient. She'd gone in the hospital and kind of had some situations we had to help deal with. She came to the office for a follow-up, and she remembered my name, her and her husband both. She remembered my name, he remembered my name, and they told me, they said, you don't understand how awesome it is to come in here and see the smile on your face and just the love that you give and the care that you have for people. And I told him, I said, well, it's my job. I said, but not only is it my job, I try to make that my personality, just, happy and go lucky. And there's moments where it's not so happy and go lucky, but I try to leave that and just put my smile on my face and just tell myself, You don't know what they're going through. And he said for you to take the time and ask, how's your day going? Is there anything outside of this that we need to talk with you about, help you take care of? Said that just, it impacts people. I have mentioned multiple times that I do want to come back for my LPN, and I say I don't want to do RN, but usually doing LPN leads to wanting to do RN. But whenever I first got into the school, I wasn't completely sure, like, okay, this is what I'm gonna like. So I started with my MA, and it was more of the basic end, which I love. I mean, I love it, I do. And only dipping my toes in it and working in it has made me realize that I want to be further educated and further experienced so that I have a better understanding of how things work, especially one, the knowledge that you gain from it, and two, now I have, the work experience. So I feel like it'll be easier to go in and grow more and be, become a licensed practical nurse. And I think it's definitely something that I want to do. I know it takes time, but I'm excited about kind of what the future might hold for me. What I think I would tell really anyone who wants to do anything medical, but especially MA since I have the experience now, is don't be afraid to take the leap of faith. If you're second guessing it, you want to help others, you want to be in the medical field, but you don't know where to go, MA, in my personal opinion, is the best place to start. You get your basic knowledge, you get as much training as there is available, and in most situations, a lot of offices that you work with, they're more than willing to do some more, on-the-job training. And they'll always encourage you to don't stop there, keep going. You're always helping people, you're giving them encouragement, your smile on your face that you bring in the room, and the personality, the care, the love that you're showing for the patient, it impacts them tremendously. And if you feel led to do it, do it. Don't be scared. Just take your leap in faith and try it out.